in terms of getting to the disclosure, right? If you have a patient and you have a bit of a feeling, oh my goodness, I might be dealing with someone who's being trafficked here. Like what tips or pearls would you give us in terms of what words should we use? How do
Yeah.
we get them just to give us a hint that something might be going on so that we could help them?
Yeah, that's a great question, Ted. And I think that what I've learned from experts like Dr. Judge and Rachel Nemec and other experts in the mental health, and trauma informed care community is that every situation is unique, and that we may not hear directly from a person the first time we meet them, and that our job in the healthcare community is to create a safe and comfortable environment where a person could eventually feel like they could come forward and seek help, because a lot of folks have been threatened, that if they tell anyone, something bad will happen to them or something bad will happen to someone they care about, and so I think that the most important thing is to show our patients who are affected by this problem that they're safe, and that everything will be on their terms, and that we're prepared to meet them where they are and provide the resources that they want, and that our medical environments are a safe place for them to come. And so I think that the most important thing is that. And sometimes it's just being sensitive to that person and saying, are you hungry? Or can I get you a drink? Or are you comfortable? Or are you cold? And some things, just very small cues that allow the person to know that they're seen and that this is a safe environment. And I think we learn a lot as physicians from our nurses in this regard. I think nurses are really great at making patients feel comfortable. And sometimes I find that things are shared with the nurses that might not even be shared yet, with the doctor. So I think that that's something I've learned a lot from our nurses. And then in addition to that, when the disclosure comes, if a person shares something with that, for us to be ready with our resources. Like, for
Right.
example, right? So, for example, one of my mentors, Ambassador Mark Latonell, who was the former ambassador at large for human trafficking, he's also the founder of Polaris, which was the first really national NGO that responded to this problem. And they had this 900 number. I think it's still, a resource. But he found that it wasn't so much the patients and the victims and the survivors of trafficking that were calling the number. It was ER nurses that were calling for advice, so that they could be prepared. And so, I always try to emphasize that we should know our resources, but we should recognize that providing someone with a phone number is usually not what sort of gets them to safety. That, we need to have something that, again, people like Dr. Jovic have taught me, are the resources of a warm handoff.